Autism Intervention Research Network on Physical Health, or ARP, Research Day at Autism CARES 2022. My name is Dawn Rudolph. I work with the Association of University Centers on Disabilities, proud to partner with ARP on this project, and I will be your MC today. Happy to be with you. Today's event follows yesterday's Autism CARES grantee meeting, which addressed the theme of changing course and taking action, exploring solutions to address workforce challenges for those serving the autism spectrum and developmental disability community. Thank you for being with us today as we showcase research from the ARP network, one of the HRSA-funded Autism CARES grantees that addresses and applies many of the topics discussed yesterday by following our guiding principles of a neurodiverse orientation to health, stakeholder-driven research, inclusion in access to research infrastructure and data, health promotion, equity, and high-quality research across the lifespan. We have just a couple of housekeeping items. This meeting is being recorded and will be archived. Closed captioning is available. There's a little CC button among your Zoom options. You'll be muted unless you're in breakout rooms, and you're very encouraged to participate in breakout rooms. And also you'll have the opportunity to do Q&A through either the Q&A box or the chat box. We will be using periodically, you may see some slides from Washington, from slides of monuments around Washington, DC. Those are throughout the slide deck to remind us that we're coming up to the end of a session to help keep us on time. So if we see a monument, we're going to get to wrapping up that little piece in the near future. And at the very end of the meeting, we will have an evaluation to get your feedback. So now let's move into the meat of things. I'm very excited to introduce Dr. Alice Kuo, the Principal Investigator for ARP, Director of the UC LEND program, and Professor-in-Chief of UCLA Med-Peds. Welcome, Alice.
Thank you very much. My name is Alice Kuo. I am an Asian female with shoulder-length black hair, wearing a white sleeveless shirt. I'd like to welcome everyone to our ARP Research Day in association with the Autism CARES meeting. If you were at the meeting yesterday virtually, I think you'll agree with me that it was a fascinating and such a wonderful event to be able to interact with each other and to learn so much from all of our colleagues. Today's event will be focused a little more on the latest research and trying to bring different ways of thinking of improving the life course trajectory and quality of life for autistic individuals. Next slide, please. So we are finishing up our second year of ARP, and hopefully those of you who have watched any of our seminars, our monthly seminars, or participated in any of our activities are aware that we are trying to promote a new wave of autism research that incorporates autistic voices front and center of pretty much everything that we do. Working with our autistic colleagues, we have identified a panel of an agenda of research topics to pursue. We are supporting projects through our various activities to translate those issues into actionable intervention that we are supporting the implementation of. And finally, I think what is really crucial is training a new generation of autism researchers who are sometimes autistic themselves to carry out this agenda and make sure that we are constantly thinking towards equity and also promoting the health and well-being of autistic individuals. Next slide, please. These are our 6 research nodes. If you have participated in our ARP Scholars Program, you will know that all of our projects fall into these 6 nodes. We have primary care services and quality, where we look to improve the healthcare experiences of autistic patients. We have community-based lifestyle intervention, where we're identifying, most notably together with the Healthy Weight Research Network, community-based lifestyle interventions that address diet, physical activity, sleep quality, stress reduction, and social connectedness in order to improve outcomes, health outcomes for autistic individuals. We have our very active gender, sexuality, and reproductive health node, which we hope to feature somewhat at our November ARP Research Day. We have our health systems and services node that is based at Drexel that looks at large-scale data and also produces the National Autism Indicators reports. And then we have our two more traditional science-based nodes, which are neurology and genetics. And we have lots of exciting things happening in those nodes as well. Next slide, please. What are we researching? So in our primary data studies, we are looking at the delivery of appropriate and quality care to autistic individuals and individuals with IDD. Again, as mentioned through our health services and systems node at Drexel, we do a large amount of secondary data analysis, which are focused on identifying healthcare disparities for autistic individuals, as well as issues of equity and diversity and inclusion. And finally, because this is the Autism Intervention Research Network on physical health, we have a focus on interventions, which are actual programs or approaches that will improve the and lessen the effects of co-occurring conditions in autistic patients. Next slide, please. So we are approaching the end of our second year, and to date, we have awarded over $400,000 to new autism investigators through our ARP Scholars Program. We have published over 60 peer-reviewed publications through our network, disseminated 200 activities, and supported 20 studies. Next slide, please. In April of this past year, we published a supplement that kind of gave everyone the idea of what we are trying to accomplish in the ARP network. This is a QR code if you want to scan it, or you can search ARP and Pediatrics, the journal, and it was published in April this year for Autism Acceptance Month. There are a number of commentaries as well as original research articles to sort of give the flavor of our work, and also the national agenda is published in this supplement. Next slide, please. One of the things that we hope to reveal in the next few months is the infrastructure for collaborative research. This ARP network is funded through a cooperative agreement with the Maternal and Child Health Bureau. And through this cooperative agreement, one of the strongest, requests from the federal government was to facilitate researchers to be able to collaborate across sites. And so over the past 18 months, we've worked very hard to build a new platform to allow for this collaboration. And it's sort of hard to explain, but we will definitely unveil it at one of our monthly seminars. But what this chart basically goes over is what we as the ARP network can do for researchers, and how researchers can submit their proposals to access and utilize this infrastructure, and then the benefit that researchers would get. For the most, there are different aspects of this infrastructure, or the ICR as we call it. One is to support the recruitment of subjects for research studies. Another is to help families of patients with rare orphan genetic causes of autism to find each other and to build registries for their particular genetic condition. There are other benefits of this infrastructure that we will reveal over the next few months. Next slide, please. Finally, coming up, we're currently reviewing applications for the third cohort of ARP scholars. We're very excited about that. As I mentioned, we have 2 ARP research days a year, one with the Autism CARES meeting, as we have done today, and then the second one is with the AUCD conference in November. So there will be ARP research events at that conference. Our second supplement is in the journal Pediatrics is planned for April 2023, and we are in the process of submitting and getting all of those articles finalized. And finally, we are working on the 10th National Autism Indicators Report, which will be on COVID-19. Next slide. Thank you so much. Thank you for attending our ARP Research Day today. I look forward to seeing you in the breakouts and in the panel discussions. And without further ado, I'd like to introduce our 2 program officers from HRSA, Eva Assing-Murray and Deborah Quint-Shellop. Thank you very much.
Thank you, Alice. Good day, everyone. My name is Eva Assing-Murray, and I'm a senior health scientist and project officer within the Division of Research in the Office of Epidemiology and Research at the Maternal and Child Health Bureau. To describe myself, I am a Black female with glasses wearing a navy blue shirt with white birds. And I'm joined today by my colleague, Debbie Quinn-Shellop, and we are the federal officers that support the network. We bring you greetings on behalf of Dr. Michael Kogan, the Director of the Office of Epidemiology and Research, and Dr. Ray Lee, the Director of the Division of Research. Next slide, please. So we represent the Health Resources and Services Administration, or HRSA, and it is the primary federal agency focused on improving healthcare for geographically isolated, economically or medically vulnerable populations. And our programs assist those in need of high quality primary healthcare, people living with HIV/AIDS, pregnant women and mothers, and the training of health professionals. And tens of millions of Americans receive quality, affordable healthcare and other services through our 90+ programs and more than 3,000 grantees. Next slide, please. I do have a few announcements and updates that I'd like to share with you. In FY22, we funded 2 Autism Single Investigator Innovation Program Awards, or SIPs, and both incumbents were successful. The Autism Transitions Research Project, or the ATRP, was awarded to Drexel University. The Autism Longitudinal Data Project, or the ALDP, was awarded to Johns Hopkins University. We also administered 3 one-year awards to conduct studies addressing ASD-DD across the lifespan, with a special focus on addressing the needs of underserved populations using secondary data and/or administrative records. And this is the Autism Secondary Data Analysis Research Program, or Autism SSTAR. We have a forecasted grant opportunity in FY23 for this program. The Autism Secondary Data Analysis Research Program, HRSA-23-069, that's the announcement number. So if you're interested, you can find more details on grants.gov, where you can sign up for notifications. And we're expecting to award, should funds be available, 4 grants with a ceiling of $100,000. Next slide, please. We also recently released our 3rd division newsletter intended to foster collaboration and share information. And we encourage you to share, as it highlights our grantees and their work, as well as provide Bureau and federal level updates. We will be holding 2 best practices sessions this fiscal year, one in the fall and one in the spring. And our next annual grantee meeting will be held in early June of 2023. If the conditions are right, and we're all healthy, it will be held in person at the HRSA headquarters. Next slide, please. On this slide is MCHB's mission and vision, and MCHB's 4 strategic plan goals, or areas of focus. In terms of our strategic plan, there are 4 areas: access, equity, workforce capacity, and impact. And these are the pillars to achieving our vision of an America where all mothers, children, and families thrive and reach their full potential. And this strategic plan will guide our work in the Bureau over the next 10 to 15 years. And we are in the early process of implementing the plan. Next slide, please. As we begin the implementation phase of the strategic plan process, it's critical that equity is prominent in all that we do. As an organization, we aspire for equity in our workplace, programs, and relationships. In addition to making health equity a strategic priority, we have adopted a holistic approach to ensure organizational and individual accountability. And this includes integrating equity into all aspects of our Bureau's work. Next slide, please. I'll turn it over to Debbie to present.
Hi, thank you. I am a white female with dark brown hair, glasses, and a black top. And I just come with a few reminders. MCHB is frequently in need of scientific reviewers with the exact background and expertise that many of you have, particularly in the time of COVID. We've been short of available experts that can weigh in on important funding decisions. So we ask that you please consider lending your time for any of our research grants that are competed throughout the year. It's so critically important that we identify highly qualified reviewers to ensure that we fund high quality proposals. So please contact us if you're interested in serving as a reviewer, and honorariums are provided. Next slide, please. Typically, we're in search of reviewers who have a doctoral degree, have experience as a PI or administering research grants and programs, and also have first authored publications relevant to the work that we're funding. Our topics vary, so again, please reach out if you are interested in being considered. Next slide, please. Thank you for your time and attention today. This is just our contact information to reach Eva and myself. Thank you to the ARP Research Network for putting this meeting together, and we're looking forward to hearing from all of you.